Is fractional CO2 laser the best treatment for acne scarring? About a year ago, I tried Retin-A for mild acne and prevention of wrinkles. I had a bad reaction to it and developed cystic acne all over my face. After going on antibiotics, oral and topical, and switching to Zorac, I now have my acne under control, but I'm left with major scarring mostly on the cheeks. Is it safe to use a retinoid before treatment? I've seen videos where people are not red or bleeding after treatment. Is it necessary to use high power setting to get better results?
Thank you for your question. You're asking a question without any photo where you want to know, is fractional CO2 laser the best treatment for acne scarring? And you describe how you had a bout of significant acne and that it's now under control, but you're dealing with scarring. And you ask at the end of the question also whether high power settings are necessary. Well, I can certainly give you my perspective and how I manage acne scarring in my practice. I'm a board-certified cosmetic surgeon and a fellowship-trained oculofacial, plastic, and reconstructive surgeon. Practicing in Manhattan and Long Island for over 20 years, I was one of the first of the group of doctors to use CO2 laser back in the mid-90s and have been using lasers in my practice for over 20 years. I currently use a fractional CO2 laser for this type of purpose a lot. So I can give you my thinking, a little bit about my thinking on how I approach a patient with acne scarring. So to begin with, there's no such thing as a best procedure for almost anything. There are options, and every option has risks, benefits, and upsides and downsides. So when you ask, is it the best thing for CO2 laser to be used for acne scars, I would answer that it depends. It depends on a few things. First of all, when you talk about scars from acne, you can be ranging anything from superficial scars to more deep and pitting scars. And what I've basically developed over the course of my career has been a strategy which actually limits the use of laser devices. What I found over time was that people were going from one doctor to another, having one type of laser, then another type of laser, and invariably they were getting this treatment with the intention of generating collagen, smoothing out the skin, and to just make the skin look better and healthier. Up to a point that may occur, but then beyond a certain point, I saw that the skin was actually becoming thinner. It was becoming less healthy. Concurrently, we've been using in our practice some regenerative medicine technology called platelet-rich plasma. So it kind of helped me kind of reassess how to manage acne scarring as well as fine lines, wrinkles, and pigmentation. With platelet-rich plasma, what we're doing is we're stimulating collagen, we're stimulating blood supply, we're creating the environment for healthier skin. Kind of the idea of what we're supposed to stimulate with heat. Now that being said, a lot of acne scarring is also deep, which means that there may be a need for subcision or release of those scars. So in combination with that, sometimes we also use hyaluronic acid filler, such as Restylane or Juvederm. So the bottom line is that the question about best treatment for acne scars is really dependent on individual situations. It's not about one treatment ideal for everybody. What I try to do is minimize the amount of thermal energy and laser treatment that I deliver, and thereby try to protect the skin from excess use of thermal energy. We live at a time where there are so many laser devices, and there's so much promotion and hype, and there's so much lack of consistency in who the person is that's actually performing the laser. In our state, in the state of New York, there actually is no licensure requirements for people who perform laser treatments. So it could be a physician, it could be a nurse, it could be anybody. So there's a little bit of a challenge there because there is more access, but then at the same time, you wonder who. Very often the technology is blamed for the lack of a desired outcome or a complication. Every patient has to have a proper evaluation. You have to look at the skin, I feel, through the eyes of a physician with experience treating skin. And we don't have to be trying to use only one type of modality. So like I said, when I treat acne scars, I look at whether or not there's deep scars, whether or not there's a need for subcision, whether there's a need for volume correction, whether there's a need for stimulation of collagen through the use of platelet-rich plasma. The last thing I'm doing is recommending a laser. A laser for me is more of something that polishes and helps smooth the most superficial level. You know, in the days before there were lasers, there was dermabrasion and chemical peels. And in some ways, there is some validity to depth or the greater the depth, the more aggressive the intervention, the more significant and long-term the outcome may be. But I also feel that making everybody's face very raw for prolonged periods of time is really not conducive to the modern lifestyle. But that putting aside lifestyle, I think that regenerative medicine technology has made for my practice, a tremendous benefit for people that would otherwise have gone through more aggressive treatments. There's an art to all of this, and there is the application of the science to this art. So you should find a doctor that you trust and understand and you feel comfortable with, who has, I would say, more than one set of tools in the toolbox and has a logic and a plan in mind. If someone says, well, just come and have just this laser and that's it, from my perspective, that's not enough. I think acne scarring is much more complex than that, and I think you're missing a very good opportunity by not applying regenerative medical technology, which for us has been extremely successful. For softening, not only are we able to help reduce the depth of scars, we're actually able to soften scars and make them look smoother without doing ablation from the top. So, you know, this PRP technology really does there's a lot to it. I also do combine PRP technology with acellular matrix, but this is a much more of a more detailed, in-depth discussion would be necessary to, in order to be more specific, and in the absence of a photo, I don't think it's warranted in your situation. So I hope that was helpful. I wish you the best of luck, and thank you for your question.